A very good morning to one and all present here. I'll be presenting a educational study that was a part of my FEMA project, a learning module for teaching clinical skills in ophthalmology, a unique approach. So basically, why did we think of this study? As many of you might be aware, NMC has introduced CBME, competency-based medical education for the undergraduates, and it's in the framework for postgraduates as well. So they have defined what to be taught as competencies, how many hours to be utilized, but how to do is largely missing when it comes to especially clinical teaching. There is a lack of structured clinical teaching, especially for undergraduates. I think we all agree upon that. There is a disconnect between theory classes and clinical teaching. To add to the woes, NMC introduced clinical postings in Oftal in second year itself. So we thought of doing this module using these two novel educational interventions, Gagne's 9-step and Payton's 4-step. I will tell you about this a little bit later. So what did we do? We developed the module that was the first phase, so wherein the competencies were identified, the skill competencies and the affective competencies from the CBME document. The learning objectives were framed, the lesson plan was formed, resources were listed, and finally an assessment plan. And this module was validated by 2 external experts. The second phase, the module was implemented among the first 30 students who came to our postings, and assessment was done using an OSCE. Finally, the evaluation was done by a qualitative study wherein a FGD was conducted among the students, 2 batches of FGD, focus group discussion, and faculty in-depth interviews were conducted. A tape-based analysis and a micro-interlocutor analysis were done. So what were the results and the conclusion? The module was effective in teaching skills to the students. How do we know that? The OSCE results. More than 80% of the students did well. They got more than 60% in the OSCE. Coming to the usefulness, majority of the students felt it was useful. In FGD, they said that the teaching was uniform even when taken by different faculty, and it was more structured as compared to other subjects. Faculty felt there was more satisfaction, and the module helped them to have a clear idea as to what to cover in each class. And they said this also avoided the repetition that happens in the clinical classes. Usually we ask them to do history taking and examination, and the same thing happens over and over again. So the conclusion is that designing a clinical skills teaching module needs a stepwise and methodical approach, and it involves meticulous planning. Gagne's 9 steps and a modified Payton's approach are helpful in designing a structured teaching module for clinical skills. So I'll show you now. These are the different competencies that are there in the NMC booklet. So we have chosen all the skill competencies. We added some extra on history taking. So instead of regular classes, NMC now wants each class to focus on one competency. So there are competencies on lead examination, anterior segment examination, pupillary examination. So this is the schedule for a 4-week posting. 15 days they have an OSCE, and then the posting continues. So I'm showing one example from the module. So these are the 9 steps of Gagne. When the students come, we first gain their attention instead of directly starting the class. So for example, this is a class on visual acuity. We ask them, have they ever wondered about how the life of a blind person feels? Then the learning objectives are put. Usually we use objectives for theory classes, but here we want the objectives to be used even in clinical classes to make it more specific and structured. Then it follows stimulating the recall from previous learning, whether they already exposed to this. So we can ask them about their class on visual acuity from the physiology from phase 1. So presenting the stimulus material includes an interactive discussion about the visual pathway. This will be mainly a faculty-based interaction, and then providing guidance. So we show them how the visual acuity is done exactly, stepwise manner. This is the step 2 of Payton's, and we have integrated both. Then the students perform it in smaller groups, and they perform on each other first before they are exposed to the patients. and their peers give them the feedback. Finally, the faculty assess as the students are performing, and we give them a retention. For increasing the retention, we give them where to study from, we give them the resources. So looking ahead, this is the last slide. So converting the module to a standardized booklet so that it can be used across the medical colleges in the country is in the pipeline. We would like to do a multicentric studies with other centers to see the effectiveness in a larger student population and similar modules for other subjects. These are my references, and thank you.
Very nice talk, madam. Any questions you'd like to ask? Anybody?
Just a comment that it has always been said that if you involve me in something, whatever you're doing,
It's not working. It is not working. Just press the button.
if a student is involved in something or if it is demonstrated, then that is what is going to be retained for long.
Yes.
So that is what you have highlighted in your
Yes,
study.
yes, exactly.
Thank you.